স্বাগত বেস্ট স্কুলে। Today our study topic respiratory system. Function of respiratory system: taking oxygen from atmosphere and expelling carbon dioxide from the body. Phases of respiratory system: there are two phases. Number 1, inspiration, intake of air into the lungs. Number 2, expiration, output of air from the lungs. Respiration rate: number of breaths taking per minute is called respiration rate. Normal respiration rate for adults is 12 to 15 breaths per minute. Parts of respiratory tract: number 1, nose. Number 2, pharynx. Number 3, larynx. Number 4, trachea. Number 5, bronchi. Number 6, bronchioles. Number 7, alveoli. Nose, first part of respiratory system. Its parts are external nose and nasal cavity. Function: helps in respiration and helps in smelling. Sinus: there are 4 pair nasal sinus. Those are frontal, sphenoidal, ethmoidal and maxillary sinus. Pharynx, second part of respiratory system. Parts of pharynx are naso, oro and laryngopharynx. Larynx. Larynx divided into 2 parts, up to vocal cord and below the vocal fold. Parts of larynx are epiglottis and vocal cord. Function: helps in breathing and helps in sound production. Trachea. Its function: providing oxygen to lungs and take away carbon dioxide from the lungs for respiration. Bronchioles. Function: bronchial secretion contains immunoglobulins that helps to resist infection. Alveoli. Function: gaseous exchange taken place in alveoli. Lungs. Lungs are the main organs of the respiratory system, located on both sides of the chest. Pleura is the covering of lungs. Function: gaseous exchange taken place in lungs. Metabolic function. And number 3 is excretory function. Diaphragm. Diaphragm is a large dome-shaped muscle located below the lungs. Ventilation. Ventilation is the mechanics of breathing in and out. Common disease of respiratory system: asthma. Asthma is a chronic inflammatory disease in which the airway of the lungs become narrow. Syndrome of asthma: number 1, dyspnea or difficulty in breathing. Number 2, chest tightness. Number 3, wheezing. Number 4, night awaking. Number 5, coughing. Pneumonia. Pneumonia is the inflammation of the lungs associated with acute lower respiratory tract infection. Cause of pneumonia: Streptococcus pneumoniae, Mycoplasma pneumoniae, and Haemophilus influenzae. Emphysema: abnormal permanent enlargement of air space of bronchioles is called emphysema. Different type of respiratory tract disease: tuberculosis বা যক্ষা, it caused by Mycobacterium tuberculosis. Otitis media, inflammation of air cavity. Pharyngitis, it is the inflammation of pharynx. Bronchitis, it is the inflammation of bronchi. Rhinitis, it is the inflammation of the mucosa membrane of the nasal cavity. Sinusitis, it is the inflammation of sinus. Tonsillitis, it is the inflammation of tonsil. Apnea, stop respiration. Tachypnea, increase the respiration rate more than 20 breath per minute is called tachypnea. পরবর্তী ভিডিও পেতে চ্যানেলটি অবশ্যই সাবস্ক্রাইব করে আমাদের সঙ্গেই থাকুন। তথ্যচিত্রটি দেখার জন্য অনেক ধন্যবাদ।